As we all know, it's been a trying time for frontline workers, but there's another group that sometimes gets left out of the loop, and that's mental health care workers. They too are frontline workers. As you know, mental health has been a big discussion during the pandemic, and with so many people seeking help, it's put a real strain on mental health professionals as a whole. A recent study conducted by Mental Health America found 93% of healthcare workers reported experiencing stress. 86% reported anxiety, 76% were exhausted and or burnt out, 75% said they were overwhelmed. So to expand a bit on this discussion, I'd like to bring in clinical psychologist Dr. Yasmine Saad from what looks to be Il Duomo, or maybe the Sistine Chapel. Thank you so much for being here. I will say, in addition to that, you're also the owner of Madison Park Psychological Services, I believe. So I really want to talk to you about this because this is something that doesn't get talked about enough, in my opinion. So let's start here. Just describe what your new schedule has been like since the pandemic hit. How are things changed for you?
So my schedule has changed tremendously. I mean, there was 3 phases of change. The first one was, in March and April when, you had to attend to your family and your work. So I switched all my schedule to night because I had to take care of my child. So I started, moving all my patients 3 to 9. And I had that for 3 months. And after that, thank God, I was able to get more childcare. And so I was able to expand my schedule. And then the demand on mental health increased so much. It became a 9 to 9 kind of a schedule. And I was able to do that for about 3 months. And then I was like, okay, this is not going to be manageable. And now I instill break, I instill self-care, and I still have a 9 to 7, but with a breaks in between.
Could you have imagined just a little while ago that you would not be able to be keeping up with demand for psychological services? I mean, that's just insane. So talk to us a little bit more about what you've been doing in terms of your own mental health. You touched on it a little bit there, self-care, things like that. Can you expand on that a bit?
Yes, of course. I mean, so I believe there's 5 major components that you have to practice to take care of your mental health. The first one is really, you want to laugh every day, despite everything that's going on. Laughter makes you have positive thoughts, makes you more relaxed. So I really try every day to laugh, either through a movie or playfulness or anyway, jokes, looking on social media, things like that. So that's one major practice I have. The other one is, love heals everything. So I try to connect to love. I mean, I'm very fortunate that I love what I do. So I love helping patients. So that's very helpful. So, but I would tell people, do one thing you love every day and then have a loving attitude towards yourself. Those are hard times, so I'm trying very hard to be compassionate towards myself. And then that needs to be me compassionate towards others. The third practice I have is an awareness practice, which is being mindful of my thoughts, what I'm feeling in my body, my emotions, and then balancing myself. If I see my thoughts are becoming too negative, I try to look at it from a different angle. If my body's tense, I try to stretch. If I'm feeling sad, I just recognize my emotions and I help move through it. And the last one, for me, the most important, is I have an energy practice. So some people will argue that physical exercise is great, and I totally agree with that. I believe actually energy practice pushes it further. And so I practice something called Qigong, which is an energy practice that helps your body heals itself and connects your body, mind, and spirit. And so thanks to that, I've been able to, rebalance myself.
Sorry to put you on the spot, Dr. Saad, but before we started the interview, you had your eyes closed. You looked very relaxed. Was that something is that something that you do often? Is that some sort of meditation? You looked very meditative.
That's right. Yes. So that's part of my Qigong practice, being aware. I have different things that I can do, but yes, rebalancing yourself, recentering yourself, observing your thought, imagining where you want to go with it. Absolutely.
Yeah. And, going back to your 4th pillar there, you were talking about what I gathered as self-awareness and listening to yourself. And that's something that is so simple in concept, but I think a lot of people overlook it, or they don't realize they don't listen to themselves. They don't take the time. And it's something that is simple in practice, but some would say it's easier said than done. But I guess in some ways, stopping, listening, closing your eyes, I think that's one way to get in tune with yourself, I suppose.
That's right. I think as human being, we all want to be doing. We love, feedback from our performance. And so we all end up doing, doing, doing. And we don't take time to really rebalance. See what have we stored inside of us? What are the emotions we're feeling? What are the thoughts we're having? And how can we rebalance ourselves? Rebalance, I think, is a priority,
It is indeed.
especially.
Yeah, you're so right. And we started off by talking about mental health for healthcare workers, your own experience, but I think the wisdom that you've shared here, I think this is something that can go for anybody. That can go a long way, help anybody, no matter what they're dealing with. These are really good mental practices to keep in mind, pardon the pun there. Dr. Yasmine Saad, thank you so much for being on the show. Really appreciate it. Thank you.
Thank you for inviting me.